My friend told me that her pap test came back normal. I felt embarrassed because I didn't know what a pap test was. So I talked to my doctor.
Now I know how important it is for my health. So, let's talk about screening for cervical cancer with a pap test. You might also hear it called a pap smear. Did you know nearly all cervical cancers are preventable if caught early? And a pap test is your best defense against cervical cancer. My doctor explained that a pap test can be done to find cells in my cervix that don't look the same as all the other cells. The test will tell the doctor if there are changes in the cells, even if they're very small, before they become something more dangerous, like cancer. So, how is a pap test done? It only took a few minutes. The doctor left the room while I was changing and gave me a sheet to put over top of myself. My doctor told me exactly what they were doing the whole time, so I felt less nervous. The doctor asked me to lay back and used a small device called the speculum to help them see inside my vagina. Then, the doctor used a tiny brush to pick up some cells in the area. The cells are then sent to a lab where they look at them under a microscope to see if there's any cells that have changed. Sometimes other tests may be done at the same time as a pap test, such as a pelvic exam, to feel the uterus and ovaries or take swabs for other infections. Your doctor will always tell you what they're doing. I also asked a lot of questions, and you can too. Your doctor wants you to feel comfortable. I asked the doctor how a person would know if they should have a pap test. My doctor told me that people with a cervix, including trans men and gender diverse people, who are 25 to 70 years old and have been sexually active, should get a pap test every 3 years. My doctor also said that if you have a cervix and have ever had skin to skin contact in the genital area with a person of any gender, this is sexual activity. My doctor told me that cervical screening starts after you're sexually active because cell changes in the cervix are caused by an infection you can get from a sexual partner called HPV. HPV is a short form for human papillomavirus. I'm glad my friend told me about her pap test, or I may not have asked my doctor about it. I found out I wasn't the only one who didn't know what a pap test was. Now we remind each other to get a pap test every 3 years, and we get a letter in the mail to remind us too. It feels great to take control of my health. Remember to make an appointment with your healthcare provider to talk to them about whether you should get a pap test too. You can find more information on these websites.